Most of you think of this month as simply November, but you may have noticed that a lot of men have been choosing to grow their beards out or their mustaches for what's being called Movember. But the actual goal isn't just to grow some nice facial hair, it's to promote awareness for a cause that may not always be on the top of people's minds. Joining us right now today to talk about Movember and why it's important is Dr. Brad Stevenson from the Ogden Clinic. Welcome, sir.
Thanks.
This is a very important issue for men to take care of. It's not a pleasant issue to talk about.
Right.
How important is the prostate screening for men over 50?
So it's very important because prostate cancer is a cancer that's easily treatable if you catch it early enough. And the problem is that there aren't a lot of symptoms that might alarm you that you might have prostate cancer, so really the best way to find it in time is to get screened for it.
Which you should really do with your annual physical each and every year. Now there is a blood test, the PSA, the prostate-specific antigen. How effective is that blood test? Because many men don't want the other, which is the digital rectal exam.
So the PSA is pretty effective. It's not a diagnosis of cancer if your PSA is elevated, but it's a red flag that we may need to look into it a little bit farther. So PSA is a good step to getting screened. Okay,
now is there a growing rate among men as far as contracting and being diagnosed with prostate cancer?
So there is some evidence that the prostate cancer is increasing. A lot of it is because we're screening more men, so obviously you're going to find more prostate cancer, but I think that's a good thing to find it.
Sure. Now the exam itself really, I can't even say it's painful. It's just uncomfortable for maybe 3 to 5 seconds at the most. And when you think about what the cost of not having that done could be, it seems like a no-brainer to most people.
I agree. I mean, there are just some places where your fingers shouldn't be, but as far as it is, it's a quick exam, and the cost-benefit ratio is definitely in the benefit side of things.
Absolutely. And then, of course, the treatments are getting better and better as time goes on. So the main thing I guess we should take away from this is don't be afraid of 3 or 4 seconds of discomfort when it could save your life.
Totally agree.
All right, Dr. Brad Peterson, thank you.
Thanks.
Brad Stevenson, thank you very much.
Thanks.
I got your name wrong all day.
That's all right. Good to be here.
Thanks, Doc.